Gregory Johnson, and we have Walter here with us today. And Walter came in to see us because he's been having a lot of lower back pain and leg pain going down his left leg, up into his lower thoracics and mid-thoracics, and even into his left shoulder blade area. So we're going to show you how we deal with that. Let's take a look in the mirror first, Walter. We've already done his orthopedic neurological examination. Let's have you flex your head forward and then backwards for me. And then forward all the way, and then back to normal. Yep. So right now I'm evaluating his posture three-dimensionally on the X, Y, and Z axes, and you can see his head's translated and tilted to the right. That's probably a function of how he's sleeping on his side. His head's turned to the left a little bit too. See how your right shoulder's a little lower than your left shoulder?
Yeah.
Yeah, and also over here, your hand is closer to your pelvis than it is here, so your pelvis has translated to the right on the x-axis as well. So that means he's got a little curvature or scoliosis throughout his thoracic spine and upper lumbar spine, and he's getting a little increased kyphosis in his upper back because his forward head posture. His ear is dropping right here over his clavicle rather than being back here over his shoulder. So, okay, let's have you go on this table first today, Walter, and we'll decompress you. There we go. Alright. There we go. And slide down this way just a little bit. There you go. That's it. This is only his second treatment here. There we go. So we should get a lot of good sound effects still. Okay, yeah. Nice deep breath through your nose. Keep your teeth together. And relax and let it out. Just like that. Yeah. Alright. Feel that all the way down, Walter?
Yeah.
Okay, good. And yes, he's still kicking. Okay, I got you. Drop it right in my hand. Will you let big toe? Okay. And just relax in my hand. That's it. Good job. Let's do some good old palm with diversified rotary brake. Okay. So, let's have you kind of get up sideways, Walter. I'll help you up sideways. Swing sideways. Bring your legs over this way. Bring your legs over. Sit up. We're going to sit up. Let me help you up. Sit up. We're going to sit up. There you go. You always just want to sit up sideways. Okay, let's go over here on your tummy. There we go. And I'm going to put your head forward just a little bit to open these joints up. There we go. We got a lot of new things going on here at Advanced Chiropractic Relief, and the next big thing we got coming is a really sophisticated three-dimensional biophysics adjusting table that I'm getting that will be doing some unique and new adjusting procedures on, including drop cervical work in the Z-axis. Also, we can do some toggle recoils, which is the very first chiropractic adjustment ever, which I haven't been able to do on this one because it doesn't have a cervical drop piece. But this new table will. I think it's coming in mid-February or something. There we go. That's it. So I'm going to do a lateral oblique stretch. I'm going to just keep breathing on this. You can see how his elevation is a little bit higher on this right side over here in his upper thoracic spine. That's the scoliosis or curvature that I was talking about when I was checking his posture. Posture is a mirror of spinal biomechanics, so when you evaluate someone's posture and you see three-dimensionally that they're not symmetrical from front to back and side to side, you can actually treat people without having to take x-rays on them all the time, unless they've had trauma or an accident, or you suspect pathology, which we rule out in the orthopedic neurological test. We take x-rays on people that have had trauma or we suspect may have compression fractures or pathologies other than simple mechanical, biomechanical issues. Now I'm going to let Joseph work on these a lot deeper, but I'm just kind of getting some stretch on his muscles away from his spine. That's really tender right there, isn't it? Feel that right there, Walter?
Yes.
Yep. Okay, so let's have you take a deep breath again. Let it all the way out. There we go. That's better. There it is. Good. Sometimes I gotta do a double take on them because they anticipate my adjustments. There we go. All those move really good on that one. Okay, so now his legs should be even, which they are. And this should feel easier coming up this time, Walter. And they stay even too. Did that feel easier that time?
Yes.
Okay, good. So I'm going to get my human meat tenderizer out and work on you for a couple seconds with this before I turn you loose on Joseph. Okay, take some nice deep breaths in. Walter some big applause there. He did really good with that turbonator. He wasn't jumping off the table like most people. Now, Walter, this should feel even easier. Good. Okay. Now, let's turn you on your back. That will help with the myofascial release for Joseph when he's going to do his deep tissue work on him afterwards. Okay, just relax your leg here. There you go. Let it go in my hands. Let it go. Nope. Got to keep breathing and relax. There. That's a little better. Yeah, just let it go. That's better. Did you feel that one a little more? Okay, let's set you up here and face this way towards Joseph. There we go. Okay. And let's just... Ooh, got some popping already in that shoulder. Yep, and just relax this. That's it, good. Good, excellent. That was his glenohumeral joints. Okay, relax your elbow. Good there on the left, right elbow. Right wrist, relax your fingers. Good. just let this go limp. There we go. Okay. Alright. Good. Now, I'm going to have you lay back on your tummy for me, Walter, and I'm going to have you lift your shirt up because I'm going to put this TENS unit on you. Now, we prescribe these to patients who have had chronic myofascial pain syndrome or scoliosis or muscle spasms, chronic intractable pain. This is a electrical TENS unit. Runs off a 9-volt battery there, and I've preset this to go for 30 minutes on a continuous pulse, and I've got it at the highest frequency at 280. So this will run for 30 minutes and then automatically turn off. You can see it's got a left lead and a right lead. Scoot down just a little bit this way. A little bit more. There you go, so I can stick this up front here. Okay, now. You want this in your mid-back or your... Put that right there. You want this in your mid-back or your lower back, Walter?
Lower.
Okay. So you can see the pads are on the left lead and the right lead are red and black. So I'm going to start with this. I believe this is the right one. Yeah, getting all mixed up here. Okay, let's do this. There, okay. So now you just want to put a black pad on the paraspinal muscle on one side, and then the spine, you'll feel it, the spine is right in the center. And then on the other side, but use the same side lead, we want to put a red one directly across from that one. And then on this left-hand side lead, we're going to do exactly the same thing, red across from black, but we're going to do these catty corner. So I'm going to put this black one right down at the base of his lumbar spine, right where it meets the sacrum, on the muscle. See, there's the spine in the center, there's the muscle. So we've got black, black, and then the red one will go across from this black one on the left-hand side lead on the muscles down in his lower back and sacrum right here. But it's catty corner from this red one. So now, Walter, if you just reach up here and turn these knobs clockwise until you feel them click on. Turn them to the right until you feel them click on. And then turn them up slowly until you feel the electricity. And do the other one the same.
I feel a little bit.
Yeah, that's turn the other one on the same. And now you want to turn it up to your maximum level of tolerance for you.
Max.
No, just the maximum tolerance for you. Yeah, because it gets up there really high pretty quick. This is a high dollar machine. We get this from Physicians Consulting out of Tampa, Florida. And we don't actually sell these. We fit the patients for them, and they provide the units for the patients and bill them with their insurance companies. Okay, you feel that one?
Yeah.
Okay, good. So what I do then is I make sure and close the lid so you don't accidentally hit that. Now you can go ahead and sit up. You can go ahead and get up. I'm just going to hold this so the pads don't come off, okay? Yeah, just make sure you... Here we go. Now see, it's got a little clip on here, so you can wear this around in your pocket if you want to. Clip it on your pocket or your belt or wherever. And then when you take the pads off, you just put them right back on here. Do you want me to take those off since you're getting ready to get a massage?
Yeah.
Okay. We'll do that. Go ahead and lay back down for a second. There we go. There we go. So you always want to make sure that you turn these all the way back off counterclockwise before you start having somebody take the pads off, including yourself. That way you don't get shocked. And then I put the pads right back on this little plastic holder directly the same way I put them on the spine. That way we don't forget. So this is the left-hand side lead, and then the right-hand side lead. We'll do exactly the same thing we did on the spine. So this is a red one. I'm going to put this one catty corner from this red one, and then the black one on this left side or the right side will go directly across from this red one, but you'll see its catty corner from, or diagonal if you will, from that black one. So the best thing to do also is to rub alcohol on the skin so you get the oils off the skin before you put this on. It has better conductivity and the pads will last longer. And then you can put this whole thing right back in its case and just fold it up, put it under your chair or your bed or wherever you want to keep it. You can wear this on the airplane. You'll wear this thing working out. Helps to control pain, causes an increase in blood flow. Okay, you can come over here and let me shoot you now. Now, let's have you flex your head forward and then backwards for me now again, Walter. Good. Excellent. Much better. Take a look in the mirror now. See, you're not forward as much and you're also not translated as much either. So let's pull these shoulders up and back. This is your homework still. And then we want to bring your head straight back this way. Don't arch your back so much, just your neck. And then translate your neck to the left. Keep those shoulders up and back. And translate your pelvis straight to the right now. No, right, like that. There you go. Hold that right there for just a moment. Okay. Right there and right there. Okay, relax again. Now let's have you flex your head forward and backwards again. It should feel a little smoother this time. Much better range of motion. Yeah. Your head's still going a little bit forward, but you pulled it up there a little bit at the end. Now see, his back's more even now from side to side, so we've gotten rid of some of that scoliosis curvature through here and some of the kyphosis as well, but we still need him working on his homework, his exercises where he pulls his shoulders up and back and then brings his head, no, don't tilt it back, just bring it straight back, see, but don't arch your back. You're arching your back too much. Just pull your head, there you go, and then look up at the ceiling, and that'll help to reorganize these muscles in a way that will help him hold his adjustments better. Okay, good. Alright, so this is how we treat forward head posture, which creates lower back pain and pelvic pain. This is your Houston chiropractor and Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.